I'm Curtis Miller. I'm an orthopedic surgeon with Canyon Orthopaedics. We're a division of OrthoArizona, and I've been practicing here since 1996. I grew up in Northern California, about an hour north of Sacramento. I was interested in sports all my life, played sports in high school and then in college, intramurals and various things. Then I went to undergraduate school in Northern California as well, and after that went to medical school in Southern California, Loma Linda University, and then attended residency at the same university. After that, I spent 4 years in the Air Force, serving as a general orthopedic surgeon in Tucson, Arizona, predominantly, and then I spent 1 year in Buffalo, New York in a lower extremity reconstructive fellowship. Really, it was at quite a young age. I don't remember ever wanting to be anything else. Even though I was interested in sports, I always wanted to be a physician. When I was growing up, I thought I wanted to be a cardiac surgeon. For some reason, that seemed like the best thing anybody could ever be. Once I got to medical school, however, I really took an interest in orthopedics. I think it had to do with the sports background that I had, and I just fell in love with orthopedics. Well, I was looking for a way to pay for medical school, basically, and the Air Force put me through medical school. I owed them 4 years afterwards, and so I enjoyed my time. I spent most of it in Tucson, Arizona, down at Davis-Monthan Air Force Base. Had a couple of TDY trips to various places, as they say. My most interesting place I went were the Azores for a month. They're a tiny island in the middle of the Atlantic, and there isn't much on the island of the Azores to do, but I enjoyed my time in the Air Force. Definitely. I was straight out of residency. I didn't go to a group, to join a group as a junior partner. I was one of 2 orthopedic surgeons at Davis-Monthan Air Force Base. The other orthopedic surgeon was only a year ahead of me, and so basically I came out of residency and had to learn how to run my own practice. Granted, it wasn't a private practice, but it was still a practice, so I was sort of thrown into the fire and tested, I think, at an early age with basically having to make my own decisions and take care of patients without a lot of senior leadership, if you would. Well, predominantly about 80% of my practice is hip and knee replacement. I do both primary and revision hip and knee replacement. Revision hip and knee replacement is essentially a second or a third time around, and when joints can fail for whatever reason. Those patients take up about 80% of my practice. I do see some sports injuries. I do some knee arthroscopy, and I also do some fracture work. I split some ER call at Phoenix Baptist Hospital with one of the other doctors in our practice. Speaking of the sports side of things, as I said, at an early age I was very interested in sports, and one of the things that we are lucky enough to do in our practice, we're spring training doctors for the White Sox, and I help out with that with Dr. James Davidson in our practice, and I'm one of the team doctors for Independence High School here for football season.